Hello and welcome. Today I'm going to give you some tips on lymphadenopathy, a condition that can signify a range of very concerning underlying health issues, from infections all the way to malignancies. So stay with me and let us unravel the causes and diagnostic approaches. Kindly subscribe if you find this informative. Alright, so lymphadenopathy is a term that refers to an abnormal change in the size as well as the consistency of lymph nodes with or without tenderness. And this can actually be categorized clinically as either localized or generalized lymphadenopathy. So typically lymph nodes measuring over 1 centimeter is deemed abnormal, right? It is even suggested that supraclavicular, epitrochlear, and popliteal nodes that are greater than 0.5 centimeters are considered abnormal. So the consistency of lymph nodes may also present as rubbery, hard, or matted. And in cases of inflamed nodes, they may even exhibit a rapid distension of their capsule, causing tenderness. Okay, localized lymphadenopathy refers to the enlargement of lymph nodes in a specific area of the body, often indicating localized infection, while generalized lymphadenopathy involves a widespread, non-contiguous, that is usually two or more body area enlargement of lymph nodes. Now, given the potential implications of generalized lymphadenopathy, it is essential to pursue further investigations to identify possible underlying systemic conditions, including infections and malignancies. Now let's find a way to think fast and smart instead of hard. To aid in the assessment of lymphadenopathy, I have devised this memorable medical mnemonic Lymph to help you when assessing for lymphadenopathy. So we're going to start with L, which stands for location, prompting an evaluation of whether the lymphadenopathy is localized or generalized. We also see I, which highlights the importance of identifying any infections, including the HIV status of the patient, infectious mononucleosis, hepatitis, syphilis, toxoplasmosis, among many other infections. I may also be used to represent inspection for erythema in the underlying skin of the affected node, as well as other areas that may include the pharynx, the skin, the ear, and the conjunctiva. M stands for manifestations, usually focusing on B symptoms like fever, night sweats, and weight loss. Pruritus is not a B symptom, but it may be encountered in lymphoma. And P represents palpation, where the size, the consistency, and the mobility of the nodes are critically assessed. And H encapsulates vital history factors, including the age, potential exposures such as tuberculosis, cat scratch, certain medications that are used by the patients, and the occupation of the patient. Other relevant information may also include sexual behavior, as HIV and syphilis may also cause lymphadenopathy. Smoking, insect bites, and family history is also necessary to ensure a comprehensive approach to understanding the underlying causes of lymphadenopathy. So, lymphadenopathy of infectious origin, as we see right here, typically presents with a rapid growth. Okay, and this results in a tender lymph nodes most of the time. This is due to the rapid distension of the nodal capsule. These nodes can appear asymmetric, all right, and it may display characteristics such as matting or erythema, and may also have the potential to drain when infected, right? Now, in contrast, lymph nodes affected by lymphomas are usually very firm, enlarged, rubbery, non-erythematous, and non-tender. On the other hand, metastatic nodes may feel matted, okay, and may be immobile. That is, they are fixed to the surrounding tissues, often exhibiting a very firm and solid consistency while remaining non-tender. All right, so here we are looking at some red flag signs that may necessitate the need for further investigations. The generalized lymphadenopathy, there is no resolution after a trial of antibiotics, white rays, Age is a crucial factor that needs to be considered when evaluating lymphadenopathy. Particularly, this is true for 40 years and older with unexplained lymphadenopathy, as this may have some increased risk of malignancy, warranting careful assessment. Male gender, systemic signs, supraclavicular lymph nodes, and a duration of 6 weeks are termed or deemed red flags. Now, in the evaluation of localized lymphadenopathy with a high suspicion for infection, a trial of antibiotics may be administered, followed by assessment for resolution. A fine needle aspiration, excisional, or core needle biopsy can also provide valuable diagnostic information, especially where there is the need to differentiate reactive from a malignant lymphadenopathy, with fine needle aspiration being preferred when reactive lymphadenopathy is strongly suspected. Imaging. So, this is also essential with the American Family Physician Association recommending ultrasound as the first choice in children up to 14 years with neck lymphadenopathy and CT scans for those older than 14 years. Other imaging modalities such as PET scans offer increased sensitivity for detecting malignant nodes, while chest x-rays can also aid in evaluating conditions like tuberculosis and sarcoidosis. Additionally, serological studies are also crucial in the initial evaluation, particularly for infections like HIV, hepatitis, Epstein-Barr virus, toxoplasmosis, syphilis, among others. A complete blood count, erythrocyte sedimentation rate, C-reactive protein levels, procalcitonin levels, as well as a polymerase chain reaction may all prove important in the evaluation. And liver function tests should also be considered if metastatic nodes are suspected. The management of lymphadenopathy is closely linked to identifying its underlying cause, hence, making accurate diagnosis is essential for effective treatment. Avoid prescribing corticosteroids prematurely, as these medications can mask symptoms and potentially obscure the detection of significant malignant conditions, thereby complicating diagnosis and management. Thank you, and I hope this was useful. If you enjoyed it, then hit the like button and subscribe to the channel. Bye.